Well, when I served in the Senate in the last administration, I had an opportunity to observe firsthand what was happening in the public healthcare system. As the shadow minister of health, I was following very closely the former administration steps as it relates to how they managed the pandemic. And we were able to put a strategy together on our own, should the Lord bless us with an opportunity to govern, how we would do things a bit different. We made a decision then that we would not continue with the competent authority. We decided that we would manage the pandemic by health services rules. And so on coming to office, we started immediately with legislative changes where we amended the health services rule to manage the pandemic via rules rather than as the competent authority. It proved to be extremely successful, and as a direct result, we were able to jumpstart the economy, improve the health infrastructural system, begin now to recruit manpower resources in health, and get a better charge on the way how the pandemic was managed. And we were able to assure that our tourism sector started, and we brought revenue back into the economy. Well, the Prime Minister is a family island representative. And so when we sat together, he articulated to me very clearly that our approach to healthcare should be the entire country and not Nassau-centric and Freeport-centric. And so the strategy was to move into the family islands very rapidly, assess the clinic infrastructure, and begin to make the necessary improvements to improve the delivery of healthcare services, primary healthcare services throughout the archipelago. And so effectively, immediately on becoming minister, I hit the road. I went and I visited these facilities, made the assessment with my technical team, and subsequently began to award contracts to improve healthcare infrastructure, while at the same time simultaneously looking at the manpower shortages, started the recruitment process and the training to make sure that we put Bahamians in these positions in the long term. On arrival to these facilities, we realized that many of our clinics in the family islands were neglected. Our staff, in particular, were unsatisfied with the infrastructure. And in order to be effective as a healthcare professional, we must take into consideration the environment where our staff work. And once you improve the environment, we realized that the quality of services improve, and we were able to get more productivity out of our staff in the midst of the pandemic, and despite the fact that they were working long hours. Equity is essential. If we're going to improve the healthcare infrastructure and healthcare delivery systems throughout the country, Bahamians everywhere in the country must have access to similar healthcare services. The only way that can be done is you have to improve the infrastructure, train manpower resources, and to make sure the essential supplies arrive in the family islands at the appropriate time. So the logistics of moving medical supplies, moving staff, looking at the staff shortages to make sure that the services that are taking place in far-flung islands like Maguana could be replicated in New Providence, and Bahamians could be satisfied with a system that is effective to deliver proper healthcare services throughout the country.
In closing, to all the nurses in the Bahamas, both new and seasoned, national and international, we extend our deepest appreciation for your service and commitments to this noble profession. As you participate in this orientation exercise, please embrace the opportunity to contribute to the promotion and delivery of better health and wellness services to all.
Well, on coming to office, we did an assessment of manpower shortages, professional healthcare manpower shortages at the Public Hospitals Authority, at our hospitals, as well as our clinics throughout the country. We realized that we had shortages of doctors, shortages of nurses, but particularly shortages of allied healthcare professionals. We realized that many of our people in the Family Islands were complaining about accessing basic labs and diagnostics and having to come into New Providence to have these services done. And what were the possibilities of assuring that these services could be provided in the Family Islands? And so the work began. I'm pleased to report that after 4 years, we're in the final stages of improving diagnostic and lab services on every Family Island. The equipment is presently in the country, and there is a system that we're executing whereby within the next few months, before the term in office is complete, we would have lab and diagnostic service on every Family Islands that is in the public healthcare system. And that's going to be a major accomplishment and alleviate a lot of the burden that many of Bahamians throughout the Family Islands experience flying into Nassau for basic things that can be provided on the island itself. Well, public-private partnerships is paramount to provide quality healthcare services across the country. I believe the time is gone where we begin to operate in silos, where you have the public healthcare system, the private healthcare system, and all of these philanthropic groups. We must bring this all under one umbrella. In order for healthcare services to be provided in the country, the government and the private sector must work hand in hand to improve the delivery of these services across the country. One of the things that's been very effective for us is the fact that public-private partnerships in collaboration with philanthropic groups is continuously improving the way how we provide services throughout the country. A good example, on coming to office, we realized that our eye ward and our eye theater was in a deplorable state. We're finally going to award contracts to improve the infrastructure. But we were fortunate enough to collaborate with the Cuban government, the Chinese government, and World Cataract Foundation, where we are able to provide essential eye services throughout the country. Today, I am pleased to report that you are the first batch and you are the inaugural flight that will be going into Havana, and I am so pleased that after 1 year of hard work with dedicated team here at the facility, the Princess Margaret Hospital, the PHA, the ministry, all of us have been working night and day to ensure that this program is activated and in a timely fashion.
Very good, very good. I could see out of both of my eyes now. We go to the clinic in Soldier Road tomorrow morning, and then in a month's time we'll be back for, hopefully, for them to release us.
I was blind, but now I can see. The eyes are so nice and so bright. I mean, when I reached home last night from Cuba, my house did look different. All the tiles on the floor looked like a brand new tile. They say, you know, repair. They say, no. And I go in my room, everything, I mean, look completely different. Bright, 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 bright.
It's been very effective. To date, more than 1,000 Bahamians receive cataract surgeries via our Cuba program. We have the Chinese Bright Vision program that's ongoing in the country, and this is a very interesting program because for the first time, patients that were not ambulatory will have access to these services. Some of our dialysis patients, some of the elderly patients who have multiple comorbidities who could not travel, are now receiving these life-changing procedures at the Princess Margaret Hospital.
We're in Foxtown in North Africa, and today's day 5 of clinics that we've been doing, field clinics out in North Abaco, bringing in general health care. We've got a team of nurses and doctors that do a general health screening, attend to any general health needs that the population might have, any patients that come in. And then we've also got World Cataract Foundation that we partner with. And so World Cataract Foundation is set up inside each of the clinics that we've been at this week, doing full vision acuity testing. And they're specifically looking for glaucoma, for cataracts, for pterygiums, with the plan of coming back in August to do those surgeries on any of the cataracts or pterygiums that we find. We're also partnering with Baptist University. That's a lot of the alumni that is our nurses and our doctors that are here.
A program that we thought was very innovative was Liquid Legacy, an eye cataract program by the World Cataract Foundation. And for the first time, we were able to do up to 90 cataract surgeries at the clinic in Abaco. We're planning other procedures throughout the country at other clinics. And it's bringing surgical procedures out of the capital into the Family Islands, something brand new to utilize our mini hospitals, one in Exuma and one in Abaco, that have been sitting there not really reaching its true potential.
Yeah, man. On behalf of the Bahamian people and our government, I want to thank the Liquid Legacy leader, the World Cataract leader who are here, and Abaco Strong, and all those who participated in ensuring that this event is a success.
How does the reduction of non-communicable disease play into the size of the hospital? And if we get it wrong, what does that mean to us, the taxpayers?
In the Bahamas, we have one of the highest incidents of chronic non-communicable diseases. These chronic non-communicable diseases are presenting to our tertiary and our primary health care facilities, sometimes with patients in advanced stages. It is important for us to make sure that our primary health care system is well-oiled and effective. Because as we begin to launch national health insurance, if you do not get primary healthcare service deliveries right, the catastrophic component becomes humongous and it could potentially be unsustainable. In our strategy, we decided that the first place we would look at is primary healthcare services. And so we named a new director of public health, who's working very diligently along with us at the ministry to ensure that our primary healthcare facilities throughout the countries are well-oiled and appropriate with trained physicians and nurses to be able to detect diseases in their early stages and to be able to ensure that we keep that cost factor associated with catastrophic care to a minimum, so that national health insurance can be a sustainable mechanism for the future. While that's happening, there is many challenges at our tertiary healthcare facilities, at the Rand Memorial Hospital, at the Princess Margaret Hospital, the Sandilands Rehabilitation Center. And these aging infrastructures, we're constantly chasing behind repairs. This is the reason why in our initial stages, we made it very clear in our blueprint for change that this administration would move to construct 2 new state-of-the-art tertiary healthcare facilities. And the one in Grand Bahama, we broke ground. That is moving, and we look to have phase 1 completed, hopefully before the end of our term in office. And very shortly, thank God, we will break ground on the new specialty hospital here in New Providence. We have outgrown the delivery of healthcare services at the Princess Margaret Hospital. There's no question of whether or not we need a new tertiary facility. The answer to that is self-explanatory. We need a tertiary healthcare facility. Our healthcare planners have guided us on how we should approach it. We decided that it should be a specialty facility where we would move specialty services from the Princess Margaret hospitals, and the spaces that are left behind will be expanded for other adult services. Our strategy for this tertiary healthcare facility initially started via private-public partnership. Unfortunately, the loan facility for the private-public partnership was not palatable. It was too expensive. And so we decided to go with financing country to country, and we approached the Chinese Exim Bank via a concessional loan facility, and we were able to clinch financing at an interest rate of 2% over a 20-year period. And it seemed to be financially feasible for the government at that particular time. And I'm pleased to report that the contract with the Chinese Exim Bank is finally signed, and very shortly the Bahamian people will see activity at the site, and we will break ground for this long-awaited facility that is much needed in the country.
Green is the official color globally that signifies mental health awareness.
Okay, so we're in the beautiful island of Long Island, and we are still providing our mental health and psychosocial support network initiative.
This week we have been in Eleuthera, the beautiful island of Eleuthera.
So we are on the island of Nagua
And Cat Island.
So we're in the island of Abaco.
We are in Nicholstown, North Andros. We actually heard a testimony from somebody who is currently living with the experience of mental illness. And that was a powerful sharing. It really was, and we had all shared that we were very respectful and really grateful that he did open up.
Well, I am very thankful they're here and excited about the initiatives for mental health. It was highlighted from Hurricane Dorian. We have significant mental health issues throughout our communities. We've had it for generations, but it was particularly highlighted after the devastation of Hurricane Dorian and the stresses that was put on individuals.
An approach to mental health and building a person's mentally and giving them support to take care of themselves and approach life in the right perspective. I think it's highly, highly, highly necessary and important.
So I appreciate the ministry for sending you guys down, and I'm sure looking forward to whatever outcome.
Something like this happening here in this small community is very vital, it's very important.
So take advantage of this opportunity, and when it's all over, we can come together as Long Islanders, as we do so well, and sit together and sort out, interact a little more, and help one another that each day can be better for someone else.
We would like to thank the staff that came down from the Mental Health Programming Unit, who gave us invaluable information, and they've promised to come back and give us our training here in North Andros.
Benefits of it are gonna be seen for a while after this, and the resources that you've given us are wonderful. Thank you for thinking about this. It's great.
Special thanks to the Ministry of Health and Wellness and to the Mental Health Programming Unit for taking this initiative and coming down here to Inagua.
Mental health is everybody's business. Mental health is health too, and just to be able to amplify that message and share it, it really means a lot.
Mental health in the Commonwealth of the Bahamas is of great concern. You must take into consideration over the last few years, the Bahamas have experienced multiple shocks from the pandemic, from hurricanes, and all of this take a toll on the mental health well-being of both the adult and pediatric population. That being a factor, we presented the mental health bill, we passed it, and we enacted it. But it could not come into force immediately because some of the arms of the mental health legislation require healthcare professional training, and that takes time. And so for 2 years, we trained 41 mental health professional nurses who are deployed throughout the country in an attempt to have more community involvement and to work with families who have loved ones who suffer from chronic mental health issues. We realize that the provision of healthcare services for mental health patients must incorporate the community. And so we are now moving away from providing mental health services only at the tertiary healthcare level and bring it back into the community at the primary healthcare level, where we will be able to work along with families, work along with the patient, and to improve the quality of life, particularly of those individuals who suffer from chronic mental illnesses. Another issue that we notice in the public healthcare system and the public service was our local government employees. Coming out of the pandemic, a lot of them experienced quite a bit of mental health challenges, as well as individuals suffering from anxiety and depressive disorders and the incidence of suicide that we saw in the country. We required a lot more focus to address these forms of mental illnesses where individuals appear to be normal in their day-to-day activity, but suffering from many forms of conditions that affect their quality of lives. And so the first place was to focus on providing services in the public system where people can access these essential services and to be able to get the care that they truly deserve.
National health insurance, as Minister has spoken to, really serves as the financing mechanism. Our mandate is to achieve universal health coverage to ensure that we have equitable, affordable access to quality health care, and that quality element is very important. Where we are, as Minister said, is in our primary care phase, and we see that as the foundation for building a sustainable health system.
In the last Christie administration, we passed the National Health Insurance Bill, and it was enacted in 2016, which laid the foundation for the establishment of the NHI Authority and put all of the healthcare professionals in place to activate universal primary health care. Pleased to report from 2016 to the present date, up to about 160,000 Bahamians are now registered with NHI, providing the necessary primary health care services and preventative care, as well as wellness programs across the country. In this term in office, we have been focusing on expanding that service, and I'm pleased to report that I laid in Parliament the new NHI Bill 2025 that repealed the old 2016 Act, which has now laid the foundation for us to be able to be more aggressive with primary healthcare services and provide a lot of diagnostic and lab services to ensure that we have primary healthcare oiled, well-oiled, as we move for the delivery of catastrophic health insurance throughout the country, and ultimately provide the basic healthcare package for Bahamians, not only in Nassau and New Providence and Grand Bahama, but throughout the Family Islands. The Bahamas have a high incidence of chronic non-communicable diseases, one of the highest incidence of renal failure in the entire region. Kidney failure, dialysis, and the whole aspect of kidney care consumes a large portion of the healthcare budget. To date, the government underwrites the treatment of hemodialysis for just over 700 Bahamians, and it's of great concern to us. And so while we're providing preventative care for good kidney health, while we're providing hemodialysis and looking at providing now peritoneal dialysis, we must also be able to offer a transplant program for kidney transplant in the country, which would complete the approach for kidney care in the country. Pleased to report again that we did our first transplant this year, thanks to our lead surgeon, Dr. Taylor, and transplant nephrologist, Dr. Carroll. It was very successful. I understand that the patient is doing extremely well, and we are now positioning ourselves to provide these services for a larger cross-section of the Bahamian population. Transplant is absolutely essential because it not only improves the quality of life of the patient, it also proved to be more economically beneficial to the country. And we're looking this year to go into that program more aggressively and to be able to give Bahamians who suffer from end-stage renal disease the opportunity for transplant in the country. So I'm excited about that. And the unit itself now is being expanded in collaboration with the Public Hospitals Authority and our lead surgeon and our lead nephrologist. Well, you know, my mother used to tell me, Michael, ounce of prevention is better than a pound of cure. When we look at chronic non-communicable diseases, up to 80% of chronic non-communicable diseases are completely preventable. They're diseases of lifestyle. And so if we could convince the Bahamian people to take a step back and look at the things that you're doing that can affect your health and take charge of your own health, we'll find ourselves a healthier population, a more productive population, and the cost of delivering healthcare services across the country will drop. So it's paramount that the ministry focus on wellness and lifestyle changes and begin now to teach Bahamians proper nutrition. Let them know the importance of physical activity. You are not, no, let me put it this way. A meal is not a meal. You have to eat nutritious food, and you must be able to put nutritious things in your body, and it will pay off in the long run. We have one of the highest incidence of obesity, one of the highest incidence of kidney disease, cardiovascular disease, hypertension, and diabetes. Basically nutrition, lack of physical activity, and vices that are brought on by lifestyles that can easily be modified. And that is our job now in the ministry, to focus on prevention, to focus on teaching Bahamians the importance of doing what's right for your own health. And at the end of the day, we'll find that we will not only live longer, but we will be more productive as a society, and the cost of healthcare will fall. We presented a new bill to the House of Assembly that's currently enacted, and it's the Health Prevention and Wellness Bill. Very important, because now we're the first country in the Caribbean who are legislating some of the components associated with lifestyle changes. We intend to bring forward a commission who would look at the foods that are being imported in the country, look at some of the carcinogens that sometimes are missed, and teach Bahamians how to read labels to ensure that you know what you're ingesting, particularly with ultra-high processed foods and foods that have all of these different colorings that can affect the long-term or your longevity. So for us, we must be mindful of what's coming in the country. We want foods that are free from contaminants, from carcinogens. We want to import in the country poultry and other forms of meat products that does not have growth hormone, that can exacerbate and potentially cause changes in your body that can be devastating. And this commission will be policing what's coming into the country to ensure that Bahamians are protected. I believe it's a very important approach, and it would add value to our prevention and our care for Bahamians, particularly at the food stores.
As we look on to our legislative regime, what are the safeguards that we have in place? Again, recognizing that the public will continue to have concerns as a responsible authority, we need to continue to be poised to address those concerns.
Well, I'm pleased that we finally brought the cannabis legislation. It was passed, it's enacted, and we're about to bring it into force. It has been a difficult transition from the bill to form the authority, train the authority, bring in the robust digital platform in order for us to police the industry and to be able to monitor from seed to sale. Medical cannabis is now gaining even more traction. When I passed the bill, at that particular time, the United States did not consider it, and they have downgraded cannabis now, whereby in the very near future, you will see that more medical cannabis legislation around the world will be enacted, and areas in the United States will be able to provide medical cannabis for patients in those jurisdictions. And so looking at it retrospectively, we anticipated this would happen in the United States, but it's finally done. And I'm pleased to report that all of the necessary steps for the digital platform is completed. It has gone by way of the Attorney General's office and the Ministry of Finance. And the authority now is about to implement the digital platform and to get activated where hopefully before the term in office is ended, we would begin now to issue licenses for companies in the country to be able to provide medical cannabis and the training necessary for our pharmacists, for our physicians, and cannabis dispensaries in the country. I want to let the Bahamian people know this is not going to be a smoke shop all over the Bahamas. This is going to be well regulated, well structured, so that the many thousands of Bahamians who need to access medical cannabis for medical conditions will finally be able to do so in the country. And I'm excited that we have gone through all of the steps now, where very shortly we will begin now to speak of it early this year in the public domain about the licensing requirement, and for those individuals who are interested in growing and to be a part of the industry and benefit from the economic component associated with providing medical cannabis for Bahamians in the country and visitors who need to access it for medical conditions. Medical tourism is big in the Bahamas. Cannabis, there are people who have chronic illnesses who want to travel but who want to access these forms of therapy outside of the country. It will be available, and we realize that there's some people who will look at our jurisdiction because they could access the medications while in the country. So I believe it will have a positive impact on tourism, but it will also be able to provide these essential medical treatments that has a taboo, and Bahamians can access it for glaucoma, chronic pain, some forms of epilepsy, and the list goes on and on. Well, 2026 is an election year for us in the Progressive Liberal Party. For me as Minister of Health, there is a lot of programs that are ongoing that I intend to work very diligently to complete. The digital transformation program for health is moving, where we will be able to launch e-clinical records, where Bahamians now can travel with their medical record throughout the country. The implementation of the chronic drug prescription plan, where we intend to expand that program from 44,000 members to the entire 160,000 members, particularly those who suffer from chronic non-communicable diseases. Our longevity and regenerative medicine bill has been passed. That has now been acted. You see many companies are opening up businesses in the country to provide these regenerative therapies, which is also enhancing our medical tourism component, and for the first time allowing Bahamians to access these life-changing stem cell and other tissue transplant programs. I'm excited about that because many of the individuals who are coming into the country are very reputable and want to use the Bahamas as the launch pad for patients to access these life-changing therapies from around the world. A few weeks ago, a new establishment was done in the Lightfoot Key area. I had an opportunity to speak to the principals of that, very reputable scientists who are providing these services in our country. All of these things are coming together to improve medical tourism in order for us now to allow Bahamians to access these therapies at more affordable prices. Everything is being woven together, and so it's important for us now, coming on the tail end of this term in office, to complete many of the programs that we started in 2021, and to lay the foundation, should the Lord bless us with a second term in office, to complete many of the projects that could not be completed within a 5-year term, particularly healthcare infrastructure. Brick, cement, steel takes time to put in the ground for vertical construction, and there is a lot of challenges with programs like that. And so we have a strategy that will be articulated very clearly in our new platform on the way forward for health. And the Prime Minister, the entire cabinet, we are committed to improving healthcare services throughout the country and to create equity across the archipelago prior to our complete launch of national health insurance, where Bahamians throughout the Commonwealth of the Bahamas can access quality healthcare services at affordable prices from Inagua all the way to Grand Key. It requires grace, hard work, and collaboration with the Bahamian people. Over the years, the Bahamian people are demanding better quality healthcare services. Healthcare is an expensive business, and so the government must look at the current economic model for the provision of healthcare services across the country, which is absolutely unsustainable. The way forward is via national health insurance to provide universal healthcare coverage for Bahamians across the country. This is the way forward. We need a new economic model. We need to improve infrastructure. We need to bring healthcare into the 21st century. We need to train Bahamians, and we need to be able to provide these services with love and compassion for our people. This requires a complete mindset change, and the process has already begun. And so as the months and years go ahead, the Bahamian people can anticipate the restructuring of healthcare services to move us into the 21st century, where healthcare services are provided with love and compassion, and the clinical outcomes are improved that will result in longevity and better equity across the entire healthcare system.
Brought to you by the Ministry of Health and Wellness.